you? She's a wee bit further to come than.
Alison's hilarious, like literally just jump out of the bed and up the road. It was great.
And yeah, literally. I dressed on down to BBC. Same Friday, but this is on my Friday. And Toby else. I said, well, an hour between 12:30 and 1:30, or after 3:30, but before 5 o'clock. I'm sitting in the trackies on ladies. And I'm okay, pushing down for it. So I have an hour. I get there. I get up on down the road.
so bad.
That again, that's a great thing because I can't always take
Why not?
maybe one day somebody will listen to us and give them a bit of money.
Right. What's your running order here? Just yes.
Run an order, Robin. Oh, sorry.
Changed it in any way? No, I just wondered if they changed it. Just step away from there. So you should stall. He doesn't mind if it's wave or something. Is that okay?
Let's have them all. See, when I feel like it's really good, just picture social media stuff. It's really important. Cheap stuff. Where is it reaching out to? The panel?
we weren't speaking over it. Good morning, everyone. I'm Joanne McAllister, and Chief Executive of the Children's Heartbeat Trust. But I'm here today in my role as Chair of the Northern Ireland Children's Health Coalition, and it's my pleasure to welcome you here to Parliament Buildings this morning. We are delighted to have such a cross-section of people in the room: community organisations, fellow charities, politicians, policymakers, advocates for families and children, and of course families and children themselves. Before we get to the main event this morning, just bear with me because there's some housekeeping formalities. So I'm not going to go into cabin crew mode, but toilets are located on this floor. So go through the door, turn left and continue down the corridor and you'll see them signed on the right. Smoking is not permitted within Parliament buildings and there's no planned evacuation drill this morning. So if the alarm sounds, we do need to evacuate the building. Please follow the directions of the Assembly ushers. When you leave the building, leave nearest the immediate route, which is just outside, keep to the right and down the stairs and assemble at the assembly point on the front lawn. Once outside, please do not re-enter the building until advised to do so. If you need assistance to evacuate, please wait outside the room. A member of staff will bring you downstairs to a place of safety in the upper car park. This will be via emergency evacuation lift, or if the lift is not accessible, by evacuation chairs. The Northern Ireland Children's Health Coalition is a collective of 13 leading charities working in Northern Ireland and was first established in 2020, just prior to the COVID pandemic taking hold. The aim of the coalition is simple. It is to improve the quality of health services and holistic support for children and young people in Northern Ireland and their families. It has long been accepted that a hospital stay for children comes with additional hidden costs to the entire family. However, although research has been undertaken internationally and in the Republic of Ireland and UK-wide, the research commissioned by the Northern Ireland Children's Health Coalition and undertaken by Professor Victoria Sims of the University of Ulster and Professor Nicola Doherty and their team is the first in Northern Ireland alone across a breadth of childhood illnesses. Shortly you will hear from Professor Sims and she will present the findings from the report. And I'm also delighted this morning that you will hear from some of the families who have first-hand experiences of these hidden costs and the impact it's had on their family lives. First though, I want to thank our co-sponsors for today's event: Robin Swan, Colin Gildenew and Paula Bradshaw, MLAs. I would now like to invite our primary sponsor, former Health Minister Robin Swan, to say a few words.
Good morning, ladies and gentlemen, and thank you very much for the opportunity to sponsor this event today, and I would like to thank my co-sponsors Colin Gildenew and Paula Bradshaw for co-signing for this event. Can I also thank the Northern Ireland Children's Health Coalition for pulling together this report and what it actually means and what it actually says on an evidence-based approach. As many of you will know, I think it was introduced as former Health Minister, but also as a father who, our youngest, actually spent the first 13 months of his life in the Children's Hospital, knows exactly what this report means to a family, and some of the worked examples that are actually here actually brought back some of those memories from those days. We were in the Children's Hospital in Belfast and Barbara Ward for most of the time, but also that included stays in Birmingham Hospital as well for heart operations over there as well. So I remember well, and I recognise many of the inputs from different families that are actually in this report. From while you're also putting that input into caring for your sick child, also the focus is there as a couple of your partner, but also the family that stayed at home. And I remembered well, and there's still a picture I have in the house. Our eldest was 2 years old and she was at nursery school, and she brought home, or she was sent home with a picture one day. It was just one of those great big black circles, and for the psychologists in the room, they'll probably start to examine this. But on the back of it, the teacher had actually written on it, Freya had started to draw her daddy, but she says this is him going to the hospital. So I still have that picture. I know what it means. So for those family members in the room, for those who are supporting those family members in the room, never underestimate the value of the support that you actually give to parents who are going through that. I also remember, you know, the coordination between myself and my wife of where one would park so we could take the other car home, so we didn't have to go into the hospital car park. to pay for that, or also that text message saying get something quick because the canteen's shut. You know, so for the parents in the room, we've all been there, we've all know what that experience actually brings. But on the counter to that, I want to say thank you for the volunteers and for the staff of the organisations that are in the room here today who are part of the Northern Ireland Children's Health Coalition, because the support that you give as well to those parents who are in the hospitals for the wider family circle as well, it's greatly valued, it's greatly appreciated, and it means a lot. It also means a lot to the health staff who are looking after the children in the hospital at times as well, because they know those additional supports are there as well. And I do want to say thanks to the staff that looked after our youngest in all those hospital facilities, because they do become, with that extended length of stay, they do become a second family. And their care and support of your loved ones shouldn't go underestimated as well. But Evan's now hasn't been in the Barber ward now for nearly 10 months, and we still get those follow-up Facebook messages every time there's a photo. Isn't he doing well? Isn't he getting big? And yes, he takes after my wife's side, so so it's one of the things that's always there. But ladies and gentlemen, there are the experts who have pulled this report together. Again, I want to say thanks to Professor Victoria Sims and Professor Nicola Doherty for pulling this valuable piece of work together, specifically in regards to Northern Ireland. But I want to say thank you to the Northern Ireland Children's Health Coalition for coming together and pulling this work together, because one of the criticisms that we've also had, we have so many competing charities working in different directions, but this shows that when it comes to the most vulnerable, our children, that we can work together and we can pull resources to make sure we're getting those best efforts and those best results for that support. So thank you very much for giving me the opportunity to host this today and also to speak. But again, I apologise that there's not a health minister actually in position who could be receiving this report today to actually start to take actions on some of the recommendations that are in it. But I do want to commend also those officials from the Department of Health who are attending today to hear from you and to be able to take this piece of work back down into the Department of Health and see what can be done. Ladies and gentlemen, it's a great pleasure to host you here this morning, and I look forward to the outworkings of this report, and I wish you well with the rest of your events, so thank you.
Thank you, Robin. It's always lovely to have your support and always lovely to hear from your personal experience as well. I'd now like to introduce and welcome Professor Victoria Sims of the University of Ulster to present the findings from the commissioned research on the hidden costs of having a child in hospital in Northern Ireland.
Good morning, everyone. I'm really delighted to be here today, and it's been an absolute privilege to work with the coalition. A lot of my research is very theoretical and no one will ever be very interested in it, but it's so lovely to be involved in a piece of research that we know will be impactful. I also want to just give a little shout out to Ben Parr, who's one of our undergraduate students at Ulster, who also contributed to this report. So thank you, Ben, because he did a lot of work, put it that way. This is kind of surreal. I've never had a next slide speak from a police person ever, which is kind of exciting. So basically what we wanted to do with this report was try and replicate a report that was published focusing on the south of Ireland in terms of the hidden costs of having a child in hospital. And we also, being a psychologist, you'll not be surprised by this, we also really wanted to look at the mental health impacts that having a child in hospital may have on families. So we have some research questions here that we wanted to investigate. So we wanted to have a look at these hidden financial costs in terms of having a child in hospital. We wanted to look at whether families felt that their physical and mental health was being impacted by having a child in hospital. We wanted to try and understand how those families are coping psychologically. And then finally, what would families like to see change? And I think this little quote for me was probably one of the most little insightful things that came through from our study. That families, even just being asked about these questions, really valued that experience. And I think we really regularly want to be able to hear from families in terms of what has happened to them. But this, for this family, was really cathartic in terms of being able to respond and tell their story. So we took the Children in Hospital survey that was used in the south of Ireland, and then we added some questions that had been taken from Tiny Life, one of the charities in the coalition. We also have a really gold standard measure of how we can measure psychological coping. So we have this within the questionnaire as well. And we were able to recruit families through the Children's Health Coalition and through the university itself. And then we have ethical governance provided by Ulster University, very important obviously, especially when we're asking questions about psychological well-being. So 398 families responded, but we were really only interested in the families who had had a child in inpatient care over the past 18 months. So we have a really lovely sample of families that have responded to this survey. Nearly 300 families where the data was analysed for that group of families. Unsurprisingly, as always happens when we send out a family survey, we get lots of mums responding and not so many dads. So we have a disproportionate number of females responding to this survey. And these families, importantly, were spread out the whole way across the nation. So they're spread across Northern Ireland. And importantly, and I think this contextualises the data that I'm going to talk to you about in a few minutes, families were earning on average 15 to 30k per annum, and when you put that then into the context of the associated costs, you can see that this is actually proportionally quite a large amount of their income is going to be spent whilst their child is in hospital. So we were focusing on infants right up to children who were as old as 18 years old, and this actually was quite difficult to try and streamline the kind of experiences that these children were being in hospital for. Really wide range of health issues: cancer, illnesses associated with premature birth, liver failure, spine bifida. So we have this huge spectrum of issues that children are facing and then experiencing this inpatient care. So there are very much many children being reported as having complex comorbidities. So quite complex cases. So on average, over the last 18 months, 35% of families reported that their child had had one period of inpatient stay. But this also goes up to more than 5 periods of stays, and that's around 20% of the families that are responding. So quite a lot of inpatient stay going on within this group. Average distance from home to hospital, 40 miles, and that is contextualised in the £70 per day petrol fees, for example. So families are travelling to and fro from the hospital setting around 40 miles. The majority of the families are having treatment in Northern Ireland, but we can see here that parents are also reporting that they're having to travel to GB or to the south. Okay, so the kind of pertinent question that we wanted to answer was, what are the financial costs or the hidden financial costs of having a child in hospital in Northern Ireland? So in this context, we can see that families are spending a lot of money on public transport if they're having to take public transport, money on taxis, petrol, tolls and parking. But also these additional costs are really important, and you can see these mentioned in our qualitative statements around trips for children to try and make them feel joyful, because that's what we do as parents. We want to make sure that our children are happy. Treats for children, data for your mobile phone, the use of the laundry service and additional clothing. If you've forgotten that jammy or whatever that's very special to your child, you're going to dash out and try and buy something additional. So these costs all come together, and there's a cumulative effect of having a child in hospital care because of these costs, yes. But then I think for me, kind of surprisingly in the next slide, is that £38 a day on food. And generally because you're not being able to access kitchen facilities. And actually in the qualitative statements, parents talk about the unhealthy food that they're having to rely on in hospital care, because either the canteen is really inappropriate in terms of the food that is being offered, or you're relying on a bag of crisps that you've had to get and grab to make sure that you can kind of be by the bedside of your own child. I'm seeing nodding heads here, so this is resonating with people. I can see that definitely visibly. But caffeine as well. This parent says, coffee is key to survival. Depending on the day and stress level, some days the amount of coffee consumed is unthinkable. And generally not having access to a kitchen facility, and you're buying coffee, and we know coffee adds up. The important thing here is, remember, these data were collected in 2020, 2021, now 2020, yeah. This is before the cost of living crisis really kicked in. So when we contextualise that with the rates of inflation, this is probably a vast underestimation of what parents are paying right now, currently. So, what about the broader financial implications? Not all families reported that they had income issues, that their income had been affected by having a child in hospital. About 50% of them reported having income-related issues because of their child being in hospital. And for those who did report that they had lost earnings, the respondent, which is generally the mother, was saying that they were losing about £365 a week. And their partner was losing about £282 a week. So 50% of families are reporting loss of income, and for those families that are reporting that, there's quite a lot of costs associated here. The loss of income around £600 a week. Put that into the context of the income bracket that many of the families are in. This is a large amount of money in terms of their annual income. And I think for me, what was really interesting is very few families are really accessing all of the income support that they could avail of. So some 43% are getting carers allowance, 21% direct payments, 63% are receiving DLA, 9% PIP, and around 18% universal credit. And I think the thing that's really important here is that this 6.5%, when we ask families about what that other is, that other is asking your own family to support your income, so having to go to maybe your own parents or your grandparents or anyone around you that can help you. So in the context of the family systems, we would always say that when money comes into the factor, that kind of can increase family stress and family arguments. And so that's really quite concerning, that maybe they're having to rely on other family members to kind of bolster your income can be very problematic. So what about in terms of physical and mental health? What impact do parents think that having a child in hospital is having on their physical and mental health? And we can see here that actually in terms of negative impacts, about 75% of families report having a child in hospital having a negative impact on their physical health. So 75% of families are having that physical health impact. And interestingly, in those qualitative statements, the thing that really came through was around backs, poor backs, from having to sleep on really uncomfortable chairs at the hospital bed. I'm getting more nods again, I can see that this is really resonating with people. So sleeping on a chair that's just not appropriate, hanging over the beds to try and keep your child entertained and happy, so that kind of physical impact. But then as well, in terms of mental health, again, exactly the same, 75% negative impact on mental health. So this is also comes through these qualitative statements about saying that obviously not all families will report having a child in hospital as a traumatic experience, but many families will. And thinking about how you deal with that pressure of dealing with a child in hospital who's very sick, but also thinking about the stress and trauma that may be associated with leaving, as Robin really clearly talked about, having other children at home that you're not maybe feeling that you're not supporting well enough. Here we have access to additional services. So you can see that many families report accessing physiotherapy, going to the GP. 50% are accessing counselling or psychological services, but around a third are not accessing anything additional support at all. So I think it's really important here that we can see that families are trying to access services that may be able to bolster their family in terms of physiotherapy or psychological therapies, but it's not always accessible, and many families report paying their own money rather than accessing physiotherapy through the NHS. So we're moving now on to trying to think about how those parents and caregivers are coping psychologically with having their child in hospital. And I think that this is really important. So really what we see is three things. Acceptance, families thinking that they have to accept the situation that we're in. This is not a situation that you would really want for anybody, but where a child is in hospital and we have to accept this. We're learning to live with it and trying to accept the reality of the fact that this has happened to me. Thinking really positively around problem solving, so thinking about, okay, I'm going to think about the steps that I can take to be able to make our children get through the scenario or the situation that they're going through. And then also using these positive supports. I've been getting emotional support from others. I've not been using alcohol or drugs to get around the situation. What I was really overwhelmed by in this survey was the really positive steps that parents are taking to try and deal with a really difficult situation, relying on others and trying to get help and support from family and friends, not doing risky behaviours like alcohol and drugs, really trying to think and focus on the child and keeping the child at the centre, but also thinking about how we can problem solve our way through these tricky, difficult situations. Now here we come to what would you like to see to change, and I would say there's quite a few things that came from this survey, to be honest. And in terms of changes, well, the first thing that we couldn't ignore, obviously, a lot of parents were reflecting back on their experience of COVID. And I would say that obviously we recognise that the NHS had to go through very difficult circumstances and deal with very difficult things during COVID, but the families really did say that they found this incredibly difficult. Especially that my family couldn't visit me most of the time while I was an inpatient in hospital, as we lived about an hour away, and visiting times booked really quickly and the time slots were just terrible. So really sometimes just not thinking about the practicalities of the families experiencing this inpatient care. Access to amenities came through very, very clearly within this survey. And this family's talking about, this is the person with the packet of crisps actually, yes, I remember that very clearly. No shower facilities not being available, food and hygiene are basic needs that can cause unnecessary stress if not met. And this reliance on junk food and caffeine came through really clearly. Connections, and this is really very positive that came through in terms of the qualitative analysis that we were able to do, about how families in the same situation were able to come together, to coalesce together, to work through the problems that they were facing. But they would really have liked additional support to be able to connect with other families on the ward, especially when COVID was problematic, obviously. But we had little to no contact with other parents due to COVID. Even a WhatsApp group or some form of contact with others would have been beneficial. To know that someone has gone down this road before you and that you can follow in their pathway and learn from the things that they've experienced. And then psychological support came through really clearly. This family here, I think, gives a really in-depth kind of story, really, in the response to this survey. But they say the best help during all of our emergency and scary diagnoses has been the introduction of psychology last year. My child has PTSD now from medical intervention. The introduction of psychology has made such a difference in the care of my daughter, who's received on the board, which has made things so much easier. Marriage and couples therapy was something that came through quite clearly as well, that this is thinking about the child in a holistic system and thinking about how this puts an awful lot of pressure on a relationship. And thinking about the family, whatever the partners may look like, the caregivers may look like, and thinking about how they work together as a unit. And talking about psychological services were offered to me once during a prolonged admission because I was very tearful one day on the ward, but beyond that it was never ever mentioned again. So the kind of, nearly the thing that I kind of got from this, from the qualitative aspect around psychological support was it was nearly like a little treat rather than being something that was offered on a regular basis. And we should really be thinking clearly and carefully about the psychological support that families get, because that whole journey is fraught with fears, anxieties, and feelings of disempowerment. So, in terms of conclusions, I think I've raced through that, I'm not even sure how long it took. In terms of conclusions, we've got very clear hidden costs. You know it, we all know it, but to have this data is very important, right? We needed to know it quantitatively for us to be able to say, here are the costs, this is what the experience of having a child is like in terms of our finances. We know as well that families are reporting that having a child in hospital has this detrimental effect on physical and mental health, and that 75%, 3/4 of families are saying it's had negative impact on my mental health, it's had negative impact on my physical health. That families are doing great things, they're doing these positive coping, using these positive coping strategies, and that as well, of course, is bolstered by all of the charities that are represented here today, trying to help support those families. But I think for me, the thing that really I would take home from this report is that need for both basic support and access to psychological services. And I put basic here like this because Basic is about having access to somewhere to make a cup of tea. It's about having access for somewhere to wash your clothes or your kids' clothes, but it's also about having that kind of community around you and access to those types of supports as well. And then obviously the kind of highly skilled practitioners that we have within support services around psychological services and the access to them. So thank you for your attention. I feel that this work is really important because it is giving that voice to the families who are experiencing children having inpatient care. I just want to thank all those parents who responded because I'm sure they had more things to worry about than filling out a survey, but they did, and it was quite a long survey and it was a weighty survey, so thank you to those families. All of the charitable partners who strong-armed me in to help doing this piece of research, and also, as I've already mentioned, Ben and Chantal, we really did a lot of work on the report, so thank you.
So thank you, Vic. That really puts the financial impact and burden that families are experiencing into perspective. And when the coalition met to discuss the findings, we did look at the emotional and psychological support. And we're working on those individually as charities, but we decided that the financial aspect was the point that we could work together on because it was universal across all families. And so this morning we knew that it was really important that we bring this research to life for you and you hear firsthand from the families who have the lived experiences of those hidden costs and what has been presented here this morning by Vic. So now I want to invite to the front our parents who have bravely agreed to discuss this in conversation with Professor Nicola Docherty. So we have Sarah Pollock, mum to Finlay, who was born with congenital heart disease and has received a successful heart transplant. Sarah, if you want to make your way up. We also have Hannah McCauley, mum to Ezra. Ezra was born 15 weeks premature with multiple complications. Hannah. And we're making sure the dads are represented, because that's very important. We have David Watson. David is dad to Adam, who was diagnosed with leukemia in 2019 and sadly passed away in August 2022, aged 9. David. And lastly on our panel this morning we have Rebecca Collins. Rebecca is mum to Karis, who has spina bifida and hydrocephalus. And leading the conversation this morning is Nicola Docherty.
Thanks, Joanne. Just before we move on, I just want to thank Vic for going through the research. I had a laugh. She was saying she was strong-armed in it. She was like absolutely loving her. It was the best of crack with everyone, and it's lovely to see the research now being summarised here. I'm only going to stand here for a minute because we're going to sit down. Hopefully you can see everyone and hear everyone whenever we're sitting down. So as Joanne said, my name is Nicola Docherty. I'm a clinical psychologist and I've been lucky enough to have had long-term relationships with several of the charities that are part of the Alliance, and it's been an absolute pleasure to work alongside them over the years. I actually am really in awe of all of the work that they've been able to do, and I hope that they can continue to do, especially in stretched times. It's been really inspirational to see the work and to see the difference that it makes. But there is absolutely nothing that trumps the children and the families, and especially the parents. They have taught me so much, both through all of the clinical work that I've done across the years, but also through the research. And it always amazes me the way that they can selflessly tell their stories in order to be able to help other people, and that's why we're here for this session this morning as well. And I also want to thank them for the contribution to the research, not just the research that Vic has been describing this morning, but also to the research that's been ongoing along with me and the trainees across the year. And there's a trainee now, Lauren, who's doing some research to look specifically at these elements as well. So thank you for that. Research is absolutely crucial. And the facts and the figures and the data is really important. It's really important we know what the overall messages are. But we also have responsibilities, people who carry out research, to make sure that the messages that have come out in summary are the ones that the parents want to be heard as well. And so we have a responsibility to bring that to life, and also we have a responsibility to implement the findings. So we're going to do the first bit of that now in the next half hour or so, is really to have a conversation with me, but mainly with the experts being the parents of the children. So we're going to just have a conversation, and we'd invite you just to be part of that conversation as you listen to us discuss these children and their families. Thank you. It's only water. So we do have mics. I thought we were going to be doing like a Beyonce moment with like the thing around and all of that, but we've got the good old-fashioned one. David looks like he's ready to go and he's going to do a song. Can the people at the back hear me, or would you want me to use a mic? Yeah, okay. Great, that's really unusual. The only people that usually hear me like that are my children. Great, so we're going to, first of all, just thank you so much for coming along today and for doing us the honour. Yeah. Oh, okay. Oh, there's a video. Have to speak up. Thank you. Thank you so much for coming along today and doing us the honour on sharing your stories. It's really important. First thing I wanted to do was just, Joanne gave a little bit of an introduction to you and to your children, but I'd just like to know a wee bit more, if that's okay. And we're going to start off with Caris. So, Rebecca, I just wanted to, if you could tell us a little bit about Caris and about you and any other parts of the family that you want to mention. And we have a photograph up behind us as well, just so, because it's really important we bring the children into the room as well. So, thank you, Rebecca.
Well, Caris is 3 years old. She has spina bifida and hydrocephalus. She also has bilateral talipes and Chiari-2 malformation. She's awaiting her 14th operation, and she spent the first 3 months in the hospital where she had 6 brain surgeries. So we've been in and out of hospital quite a bit with her. She has 3 older siblings that live at home with her, a 17-year-old, an 8-year-old and a 7-year-old. And I am a primary school teacher where I've had to cut back my hours, whereas a full-time primary school teacher now I have to work 3 days a week just to accommodate the appointments that I have to go with Caris. So it's been quite difficult, a difficult journey, but one that I do all over again for her. So yeah.
Thank you, Rebecca. Do you want to hand over to Hannah, and I can ask her then about details about your child.
This is Ezra. He was born last year on the 8th of June, so he's just turned 1. He was born 15 weeks early, so he came at 25 weeks due to a very severe bout of preeclampsia. He spent the first just over 4 months in hospital between the regional neonatal unit in the Royal and then our local hospital in Antrim. He has had all the things going, so we've had sepsis and brain bleeds and a hernia, and he's had laser eye surgery, he's had, a clot somewhere behind his liver, jaundice, I always forget jaundice, but he had that because it just seems to fade into the background. Like I said, he's now 1 and he is doing really well, but we're still under a lot of different departments, dietetics, physio, OT, eyes, just everybody still seems to be there, so it's appointment heavy. Before I had him, I worked full time for a charity in Belfast, and while I was on maternity leave, I saw a role out with Tiny Life, so I applied for that and got that. So I'm delighted to both be a staff member for Tiny Life, but also a Tiny Life parent. And I really would be lost without them, so it's lovely for it to be a big part of my life. And Ezra is about here somewhere, so we hear a baby 100% in.
And Hannah, what was the line you gave me whenever we met briefly on Zoom about Ezra?
Oh my God, did I call him the best boy? Yeah, he is just the best. As Rebecca said, it's a lot, but you wouldn't change it because he's the best boy.
Thank you. Do you want to hand over to David?
So, get this bit out of the way early. Adam was 7 years old when he was diagnosed with acute myeloid leukemia on the 21st of October 2019. Adam fought leukemia for 33 months. He had actually relapsed twice during that time period, of which he also spent a period of time, 12 weeks in Manchester, where he received a cord blood transplant. And then, sadly, Adam died on the 3rd of August last year. So, still within that first year and all the first to go with it, but my wife Sarah and I are delighted to be able to help in any way we can and telling our story to try and help others. Adam spent just over well, he was sick for just over 1,000 days. It was 33 months, of which he spent nearly 300 of them on and off in hospital. His longest day from memory was about 78 days, of which he got out twice, and that was to go to a dentist at the Royal. So we know only too well a lot of this hidden costs, and it's not that you sit and see them on a screen that it really hits home, because at the time you don't think about it. Your priority is your child, and it's not that you see it now and time to reflect on it, you really see the impact that it's probably had on everyone.
Thank you, David, and thank you for bringing Alan's story to us today. Really appreciate it. And Sarah.
I'm the crab one of them.
Yeah, it's one point one.
Seeing all that black and white just does.
Yeah.
So, I'm home to Finlay, who is going to be 6 here at the end of June. Finlay had a heart transplant on the 14th of July 2021. That's him on the left, but on the right was last week at Sports Day, which is something that I didn't think he ever would have been able to do. So there was no tears actually that day, and clearly I saved them all for today. So Finley's doing great, but we spent 11 months in hospital, and that has to have been the hardest time of our lives. But we did it. So we're here.
Okay, we've got to do Sports Day. Did you do the Mullers race?
Thank you.
Thank you. And it is really important to be able to recognise whenever things touch you as well, and whenever all of that brought out, and you're like, yeah, that is my life. That's not just a piece of information that we share with other people, that is actually, yeah, we've lived experience. Yeah. And we really appreciate you when we come on today to be able to highlight to others people in the room, to really highlight what will be important to help as we move forward. So you've all had really different experiences in terms of length of time in hospital, but really long periods. I think David, you said it was a really stark figure there that over a third of Adam's period of being ill was spent in hospital. So, yeah. And Hannah, can you remind me how long you said you were in hospital with Ezra?
So we were in there just over 4 months. So yeah, first kind of give him time to catch up, and he came out just after. So he was due on the 17th of September, and he came home on the 10th of October. So just slightly over when he was due.
So it's another long period of time, and you're still in contact with
We still see a lot of the specialties, but hopefully we'll tick them off one by one.
But that probably requires ongoing hospital visits, but no overnights at the moment.
Absolutely, so we have a lot of visits, a lot of appointments, maybe two a week, and then occasionally we might get, we've had times where he's picked up, a wee fever or an infection, and we've ended up back in, or an overnight or a weekend in. So yes, hopefully they don't come too often, but they do appear.
So that, just saying that sort of fever or things like that there's a lot of monitoring just in terms of you being hypervigilant.
Absolutely, it's in doubt. We're well known in Antrim Hospital, in paediatric A&E, and also in the children's ward. So it's straight down, and sometimes it is just a precaution, just to make sure. But it can lead into weekend stays or overnight stays, which is tough, because when you foresee them, it's all of a sudden who can take time off, who's going to stay, right? We need to cancel all those plans, and everything just gets a bit thrown up in the air. But as we said, you do what you have to do, and you are where you need to be.
It's going to be really unpredictable.
It can be very unpredictable. You can make lovely plans, and all of a sudden it's no, we're away to hospital. So sometimes you keep the plans not too planned.
Yeah. Okay. Sarah, does that resonate with you as well in terms of length of stay?
Well, we were quite lucky. Finley was diagnosed when he was 18 months, but from 18 months until he was in the hospital when he just turned 3, we only had a couple of hospital stays. So we were quite lucky, but we found that because when he was diagnosed, your whole life just changed. You didn't plan things. You had to be so careful. You couldn't go to the swimming pool, you couldn't go to play parks for risk of germs, and a ball pit, there was no way you'd ever enter anything like that. All the things that you take for granted with a child, we couldn't do, but it became our norm, and we just got used to it. So we're quite lucky that we were able to be at home the majority of the time with him.
And how long were you in hospital when he was 3? You went into hospital?
He was down on the 8th of October. He went for an appointment that day and didn't be home for 11 months. He was really ill then. I suppose we always knew it was going to happen, but
Yeah.
when it did, it was
Yeah.
yeah.
Yeah, it's sort of that hypervigilance about just waiting for the change.
Yeah.
Okay.
Yeah.
And then did you say you went to England and England for that?
So Finley was an inpatient in the Royal in Clark Clinic, and then he took a cardiac arrest on the 3rd of June, and we were rushed to Newcastle, and he was really ill. So we were there for so many weeks, and then we came home on the 11th of July, and on the 13th of July we got the call to say that there was a heart for him. So it was all systems go.
And at home as well, is it Finley?
Finley has a big brother, Alfie, who's 10. So we live beside my mum.
Yeah.
So she took over the role of looking after Alpha. Whenever we were in hospital, I gave up work whenever Finley was diagnosed. I was a legal secretary, and his daddy kept working, so I did the appointments. His daddy did as many as he could with them, but I did the most of them. So in Belfast, I was there during the day, and his daddy came down at night. But when we were in Newcastle, his work take 3 months sick leave, and I don't know what I could have done. I wouldn't have been able to do it, you know. So.
Thank you, Sarah. And Rebecca, in terms of your story, you've been in hospital a lot with Keris.
Yes, we've been in and out quite a bit over the last three years, yeah. She was born 2 weeks early and everything was okay, but it was the shunt that kept breaking down, so she had to have 6 surgeries to rectify that. Her bilateral talibes gave her a lot of bother as well. She had quite a lot of surgeries on her legs. We're waiting another surgery on the 13th of July where she's getting metal rods that have been put in to come back out again. She's also just been out of hospital. She's in with a UTI, a severe UTI, which just came all of a sudden as well. So we spent a week in hospital with her then as well. She's catheterised 3 times a day. It's the unknown. We just don't know what's going to happen on a daily basis, and we just have to roll with it.
There's a theme there about the unpredictability and things changing and having to have a significant impact, you've all said, on your working lives as well, because it need to be with your child. Is there any other impacts that any of you wanted just to mention in terms of the impact of hospitalisation that you haven't covered so far? I suppose we're thinking specifically of today, and because you mentioned things like just changes in jobs and the need, Sarah, you mentioned there, just the need for your husband to be with you in England, and then there's obviously the worry is it going to have a financial impact as a result of that. If you were able to just tell a wee bit more about the impacts generally and anything specific to the financial impact?
I guess it's a case of understanding that when your child becomes sick, especially in our case where we just Adam basically developed a sore throat with the usual GP procedure, wasn't getting any better, went to Daisy Hill, NE, and 6 hours later we were told he had leukemia and we were getting blue lighted to the rod. So immediately our world just got flipped upside down. Adam's an only child, is an only child, and we both sort of took a conscious decision that at the start of your heads everywhere, you don't know where you are, so we both immediately took off work. I had regularly work from a cousin who looked after me as best he could throughout, so I worked for quite a big company who again has a 6-month, sick pay or whatever the terminology is. But Adam was sick for 33 months, so that wasn't long before it ran out. I tried to get back to work as and when she could, but I think in 1 year she worked 3 days. So you double long there for 6 months and you couldn't even work long enough to rebuild it or recruit at the other end. So trying much just identifying that this is where we are, and you're getting your statements at the end of the month, they're saying, right, what have we got in the pot here? And then dividing it up with the suit, travel, food. You're trying to run nearly 2 houses. There's the room in the hospital, and then there's the house at home. So it's a case of just been very, very careful and budgeted, but then you're also trying to give Adam what we were trying to give him the best time we could. If it was a treat, if it was an extra game, if it was Roblox coins, and all those things add up. And as I said in the interview earlier on, we were very lucky with the family and friends we had. But again, nobody wants to be a charity case, nobody wants to have to go asking for money. So I guess this is where this fund becomes vital, and even if they can find a source fuel, that's one less bill you have to worry about or think about. So anything is better than nothing at this stage.
Anybody else want to comment? I think your mic's going a bit dodgy, wasn't it?
You still have the bills to pay at home, but you know, your life's turned upside down, but your mortgage still needs paid, your car, your insurances, everything still needs paying at home that you would have been paying beforehand. But now you have this added expense of, in our case we were buying food for home, for Alfie and whatever, but we also had food for the hospital because there was no facilities for us. Even things like tea and coffee, I mean, I've been on so much weight in hospital because you did not eat properly. What I wouldn't give someday for an apple or something instead of a bar of chocolate, because that's what you lived on. It was a sugar rush just constantly. And nearly it came that the day got so long that you ate nearly out of boredom. Just to give yourself something to do, well, I'm going to go for a walk here and get something. That's no way to live either. You know, it's...
The world sort of kept on turning while your own world was flipped on its head.
Yeah.
And there's another layer. You had all the normal stuff of life plus this additional very significant layer.
Yeah.
And as you said, David, you want to do the best for your child and give them all the most positive experiences. But a lot of those, especially roadblocks, comes with a lot of loss. Yeah. Hannah or Rebecca?
Yeah, I'd say it's you know, 25 minutes. They tell you not to shop too early for the baby because you never know what's going to happen, and don't count your chickens before they hatch and all of that. And then all of a sudden I had a baby and I had nothing, and I wasn't going to leave Ezra's bedside to go and shop for prams and cots and all the things that you're supposed to do, and I don't know what we would have done. All of a sudden stuff just appeared out of nowhere in our house. Poor Reg, I don't think he got anything of his own for the first 5 months of his life. Everything just belonged to someone else beforehand. But I don't know what I would have done without that kindness of sometimes nearly strangers, you know, people who knew someone who had a baby and was, you know, ready to pass stuff on. And we really needed that because I was expecting 3 more paychecks before I had Ezra and before maternity leave was kicking in, and that didn't happen. And I didn't have the time. I didn't want to go and have to baby shop because I actually didn't know what was going to happen with my baby. Was I going to go baby shopping and not bring baby home? I didn't know. So without that kindness of sometimes strangers, sometimes loved family members, we would have just been really stuck and stressed. And that was another level of stress that we just didn't need at that time. Because we say you're in hospital and you're not thinking about the electricity that's still building up and the bill that's going to come in. You're not thinking about the mortgage. You know, the bank are going, oh no, your hospital will not send you a bill this month. I wish that happened, but it doesn't. And it just keeps, as you say, life keeps going, but your life is not about your house at all. And you eat what's there. Or if you do come home from hospital for dinner, you don't want to cook. There's nothing in the house to cook with anyway. So you just end up eating more rubbish, and that's another expense. But it just is where your head's at that time, and it's really tough.
Yeah, sounds tough.
I'm not going to speak very much, but in essence, why should a family go into debt because a child is ill? I know that we got funding from Family Fund, which was fantastic, but it just wasn't enough. My husband was actually laid off on the day that my daughter was born. And it was very difficult. I was during COVID as well, so we struggled a lot. I think emotionally as well. So I think this fund in itself would be, or this grant would be absolutely amazing, just for every aspect of life, because I know we would have definitely benefited from it, and we would have been more maybe focused on Caris more than how are we going to pay the mortgage, how are we going to pay the bills.
You don't want to worry about that, but
It's a reality.
You don't want to lose your house.
Yeah.
You know, you have to be realistic about it.
maybe a man thing. I was totally different. I wouldn't give a stuff. I had to live in a tent as long as he had everything he needed. So.
And absolutely, like we would have done anything for Caris, but you have the reality that you still need to pay the mortgage, you still need a house for your other children, and there's life going on alongside your little child. But yes, I think my bugbear was that why should we be going into debt because we're looking after our child who's ill in hospital?
It sort of sounds like you're balancing, you're all balancing so many different balls. You've employment, in some cases other children, and you've got then running a house, running 2 houses it felt like, plus thinking about your career, which people do careers because they want to gain money, but also usually sense of fulfillment as well, so you're going to be actually tied up in that as well. There's so many different balls that you're all juggling at once, and it just feels like the ball that was you as the parent looking after your child got really, really big because they really needed you in that moment, but those other balls still had to be juggled. So how do you keep them up there in the air? And you mentioned a wee bit there, Rebecca, about how it would have helped, in your situation where there's even a number of different layers and things going on. Does anybody else want to comment just about what a difference something like the young person's fund would have made for them?
Yeah. I think it's someone, I have maternity leave, which was great and I'm very thankful for. But my husband is self-employed, and when our son was lying in intensive care, he had to go back to work. He had to go back to work because there's no sick pay and there's no maternity leave and there was nothing. So every day that Mark was at the hospital with us, there was no income coming in, and that was really, really tough. So to know that there was a fund or a grant or something that would just help and maybe, help my husband maybe not feel like guilt, because it was horrible of, if I go to work and I'm leaving you there, I'm leaving him there, but if I don't go to work, we have no money and what are we going to do? So I think just to have something there to say, you can be in hospital, but you can be in hospital without the guilt of, feeling that you are the sole person that without you, what are we going to do? And it wasn't fair. He shouldn't have had to leave his son in intensive care to make sure that we had a house to come back to whenever the time came. It's not a fair thing to have to choose between. So yeah, just anything that is there, and having my husband being at work, we ended up taking 2 cars, and that's double car parking, and it was just, as I think as Robin Swan said, you do work out where can we park the car that's outside the hospital, so that the car parking pass that we were kindly given gets us out. We don't have to pay any car parking, because that $5.50 or more, it matters. You need that, because $5.50 every day for 4 months ends up being a lot of money.
I guess I can really say that any sort of income or any sort of money that people can be given is going to help in some shape or form. Should be fuel money should be set aside. That £500 is purely for parking. Just keep it up. Every wee bit helps. So we used to plan that. Even if I had an outpatient appointment, which is maybe 3-4 times a week, and some days it was nearly a man and a home job, because 9 times then you couldn't get parked. So rather than making them walk away over from the flats and up into the clinic, it was a case of me driving up the door, dropping them off, trying to get a space, and then bouncing back to go into the appointment with them. So when we get that £500 fantastic, there's probably small elements that could change in the hospital too. That would alleviate a lot of things that are on that board, but I think that's a story for another day.
Yeah, so where can we start? There's certainly a lot of different elements there. I'm just really taken back by how much you've had to juggle or problem solve there as well, just in terms of all the different pieces of the jigsaw that you were trying to solve at the time. And I know you all mentioned different things about families and friends and employers being really, really supportive. But as you say, you don't really want to go and ask, but is there something that was available that could just remove a chunk of the worry to allow you to be more free, being a brain, to concentrate on the other areas, whether it's your, especially when it's your child. So I said I didn't give you a chance to ask there. Was there anything else you wanted to say? No. Okay. So you've you've talked a lot about all the different elements, and it sounds from what you're saying today that the research, the black and white stuff that Vector put up on the board really resonates with you. You really highlighted. You've mentioned all the things that were found in the research through a big group of parents, but you've really brought it to life through the conversation that you've been so willing to have this morning. Is there any last points you wanted to make just before we finish off? Joanne did say I could have as much time as I want, but I don't think even into lunchtime. So I'll just give each of you a chance just to make a final point, if that's okay.
Just because I'm holding the mic, I'll finish off for my part anyway. I think it's just important that all the stakeholders that are in the room today, whether politicians or whoever, you go away and talk to who you need to talk to, and whether this place is working or not, because let's be honest, there's women that never get back in. There's other ways around things, and ways we can lobby, and there's another big place across the water that we can get stuck into too. So it's just getting everybody together, and it's great to see 13 charities all fighting together, because that's what it is, it's a fight. Like these kids and all the kids are fighting most days for their life. It's now a fight to try and make it easier for the parents and the families.
Well, I completely agree with what David says. Any help at all would be fabulous. It would be fantastic. Just take the stress off day-to-day living, and just know that you're being appreciated nearly, that you're being recognised. I think was the word, that you're doing a little bit more than and above than maybe others, and a wee bit of help just financially would go a long way.
I think maybe it's that these children are not sick of their own choice. They're not having long hospital stays because they want to. It is something that is thrust upon them, and it's horrible and it's not fair. And any help that we can have, we're all trying to be the best parents we can be, and that's all we want. We just want the best for our children. And it's not always nice to have to come and ask for a little bit of help, but we do, because we love our kids and they deserve the best, and you guys can help us do that. You can help us be the best that we can for our kids who are going through horrible things and things that they shouldn't have to do.
I don't really think I could add anything more to what you said. Without charities though, and friends and family helping you, people are, when you have a sick child, you realise how kind the world is, and strangers helping out. Funny, used to get things given to him because he was in hospital. Here's a toy, or he was spoiled rotten. But you know, we thought, well, you deserve it. But it would be nice if there was just that added support, just to help, just take away one of the worries, just one.
Yeah, it's one worry, it's a significant worry, but it has huge ripples, is what I'm hearing you say, in all parts of your life, and for something that you can't control. And if someone could help provide some control in that basic part, then it would help send out some help availability from where the positive stuff that you can do, and help you, as Hannah says, to be the best parent that you can be, because that's what you want to be, and it's benefit not just for now but into the future as well, because we know about the physical impact, we see it, we know about the mental health impacts, but if we can reduce one aspect, you hope that that will shift things for the better.
None of us chose this life. This is just the life we were given, and we're all winging it and dealing with it as best we can. So any help from anything would be appreciated.
You've all done a great job, not just this morning, but in the parenting as a whole. Sounds like you've all been the best parents that you could be. And Ezra, Harris, Adam and Finlay can all be very proud of their parents this morning. Thank you so much for your contributions, for sharing your stories with us all this morning. I think you deserve a massive round of applause.
Thank you, Nicola, for leading that emotional conversation. It's really important to see in real life how this affects families, and I think you're all winging it pretty well. A heartfelt thanks on behalf of all the charities who you represent this morning, and all the other members of the coalition, to Sarah, Hannah, David and Rebecca for bravely sharing your story. We're pleased to have some of the team with us this morning from Young Lives versus Cancer. Sonia Malik and Ben Lejack are going to share their work on establishing the Young Patients Family Fund for Scotland, which helps support families financially who have a child in hospital.
Thank you. It's so nice to be here, and thank you again to the families who shared their experiences. If you'll indulge me, a personal moment as a parent of a child with a health condition and disability will relate to all of those hospital costs, the intensive care stays, the unplanned visit, the planned visits to hospital, the numerous appointments, and they all really ring true. So thank you for having us here. We are a member of the coalition. We're a relatively new member, so it's really lovely to be here. But Ben and I are here because we've gained a certain amount of insight with those we support, and particularly with campaigning for the Scottish Young Patient Family Fund. So who are Young Lives versus Cancer? We provide a range of support for young cancer patients from 0 to 25 across the UK, with a range of services including our excellent social workers. But we're just one of many charities that support children and young people with health conditions, many of which are members of the coalition. We also campaign for change on the issues that those we support tell us are important to them, and that's how we've come to be here. So what we'd like to tell you about over the next 10 or so minutes, the insight we've gained from young cancer patients on the issues and the solutions, and the different funds that are available and support that's available, in particular the Scottish Young Patient Family Fund, and what we can learn from that for any other support in the rest of the UK, and in particular here in Northern Ireland. We're speaking from our experience as a cancer charity, so if I talk about cancer, it's not to exclude any other conditions. There are so many similarities. It's just because that's our insight and our expertise. We're here to hopefully tell you what we learned from that. So, we've heard excellent research. There's a strong evidence base on this, and we've also heard powerful stories from families. We know the costs are extensive when you have a child that has a health condition or a disability or an illness. And we've heard, I used to be the research officer in our team, and I've heard these powerful stories over the years, and they haven't changed, and the costs are getting worse and more because we are in a cost of living crisis. We also have, Young Lives versus Cancer also has a body of research which really supports all of this research here today. We can see the costs and how they're impacting all these families. Amongst those costs, one of the biggies is travel. And that's not right. You shouldn't have to spend money to get to treatment or appointments for travel. Families shouldn't have to be worrying about how they're going to get to vital treatment. There is support available. Charities are doing their best to provide grants and funds. There's also welfare and benefits, some hospital transport schemes. But what families are telling us is that it's not working for them. It's not enough, it's inconsistent, and they're really struggling. With welfare and benefits, you might have to wait several months before you can apply after a diagnosis or an illness, and then you might have to wait many months more before you get those payments. Also, when it comes to disability payments, they're not there to provide families to get to hospital. They're for the additional costs of having a child who is disabled or has a health condition. Some of the support is means tested, and we know these costs are hitting all families hard. And we also know that charities can't do it all. If we're providing funds for getting to the hospital, then we're not providing other vital funds or support that we can do. Young Lives versus Cancer have been working with many others for years to try and bring awareness of the issues and change this. And one of the successes of that collaboration is the Scottish Young Patient Family Fund. Now, just to clearly say, we don't administer that fund, and we're not part of the Scottish Government, we're not speaking on behalf of them, but we are a really invested and interested stakeholder, and we've taken on a responsibility that we feel very strongly to ensure that that fund delivers for those we support. So we're working closely with departments, cross-party elected representatives to challenge, question and support the implementation of the Scottish Young Patient Family Fund so that it really delivers for those we support. And I will hand over to my colleague Ben, who is the man with the details, to tell you a bit more about the Scottish Fund, how it works and how we can apply it here.
Thank you, Sonia. So as Sonia mentioned, we have the Young Patients Family Fund in Scotland as a new resource for families travelling for a young person or child in hospital care. So to give a little bit of background on the Family Fund. It was launched in 2021 in its first instance, but it built on a previous resource, the Neonatal Expenses Fund, which itself was launched in 2018. That was launched with £1.5 million worth of resourcing and was intended specifically as financial resource for parents of a newborn whose health support needs necessitated long hospital stays. So there was previous administrative infrastructure to build that fund on when the Scottish Government heard calls from charities and other organisations for more support for families travelling to hospital care for a child or young person. So in terms of eligibility for the fund, how can you claim and who can claim? The key aspects of who is able to access this financial resource are firstly that you are the primary carer of a young person or child in hospital. That's usually a parent, but can also be a guardian or in some cases a sibling. The young person in hospital care must be 18 or under 18. And the family who's claiming for that money must both be ordinarily resident in Scotland, and also the child that they are claiming on behalf of must be receiving their care in Scotland, which, as we've already heard, there can be travel very long distances for young people with long-term health support needs and long-term hospital care. In terms of what can be claimed, the main expense covered by the Family Fund is for travel. And as you've already heard from the fantastic panel just now and from the research, this is an enormous expense. And this is the main source of support that the fund offers, that any travel, one per day, can be claimed back from the fund. So the cost has to be incurred and then claimed back via the hospital. That is then charged to the health board, who claim the money back from the Scottish Government directly through the Family Fund. The secondary aspect of the support from the Family Fund is around food costs. That is limited, £8.50 per day for food or drink, or 3 meals provided by the hospital directly, depending on the case. But food can also be an enormous expense, so this goes a long way as well. And finally, in certain cases, accommodation. By and large, this isn't something offered by the fund, but on agreement with health boards. This is an aspect of support that the fund can help cover as well when needed. Now, this is a really, really new resource still. We're in its third year now, and so knowing what impact this fund has had to date is going to be really, really important for learning how it's done well and what can be improved, especially if we're hoping to replicate this kind of support elsewhere. We know that this fund is having a massive impact for the people who are accessing it. We know that there are hundreds and hundreds of pounds worth of travel costs that families are able to claim back from this that save them going to a family member for asking for that support or having to incur debt to access that money. But because this fund is so new, we're really reliant on data that is routinely collected from health boards in Scotland. And some of that data isn't collected, so there isn't any data on individual conditions. So we don't know what the balance of health conditions is for families claiming through the Family Fund. And we don't have any information on patient age either. We don't know whether it's families of older or younger children that are claiming the support more. But there are some things we do know. We know that in its first year of operation, the fund, which was allocated £5 million, had £2 million claimed from it in its first year. We also know from our own research base that large numbers of families in Scotland are not aware of the financial support available to them. So that gives us some leadings for ways that improvement around the fund can be made with awareness. We're also waiting for more information that we know the Scottish Government will collect. The total number of claims there have been and the average amount that's claimed. That will be really, really important information for knowing how this fund can most effectively support the kind of costs that families are incurring when travelling to hospital care. The Scottish Government have committed to continuing to work with health boards to ensure that the fund is as accessible as possible and that it continues to improve. We're really grateful that conversations with Scottish Government now are turning towards a full review of the fund. We consider that the next sort of important step in making sure that this fund, now it's been secured and now it has 3 years of operation, and we know that it is providing really, really important support. Having a full review of the fund to have a really full understanding of how it's doing, what can be replicated elsewhere, and what we need to learn from if we are going to replicate it elsewhere, is the next really important step. I'll hand you back to Stormont to wrap up.
Thank you. So in terms of reflections, limitations of the fund, lessons learned, we know that it doesn't go far enough as far as we would like it to for the patients we support. One of the gaps, as you might have noticed there, is outpatient treatment. And I'll just read a quote from a Scottish parent to demonstrate just how important that outpatient appointments cover is. If she has to go in for an MRI scan, or she gets hearing tests, or when she gets her chemo, everything that's in and out on the same day, we don't claim for that. We can be there quite a lot just for the day. Sometimes it's multiple days a week. We go for her chemo one day, come home, and we're back again the next day. So that's easily 4 journeys that we're having to cover. So you can see a massive gap by not covering outpatient treatment. The experience of claiming money back is a big issue for people as well, rather than having it up front. Another quote here to demonstrate that. If there was a grant to be able to do that instead of having to wait to get it back, because not everyone's in a position to be able to do that. Not everyone has credit cards or parents who are able to help and pay it back. Families are getting into debt. As one of our panellists said, you shouldn't have to get into debt. You shouldn't have to be finding this money, scraping around, worrying, stressing. It should be there for you. One of the things that aren't covered in the Scottish Fund is travel across borders to other nations. Now this is because they say it's covered by other mechanisms, by health boards, by individual hospitals, but families are telling us that that's not really working for them. The inconsistencies, the stress of it, it's not really working as it should. As Ben said, awareness and access uptake of the fund is not as good as it could be. People aren't using that money not because they don't need it, but because they don't know about it or don't know how to access the fund. So in any new support, it really needs to have that awareness. Everyone needs to know about it, and everyone needs to make a concerted effort to make sure the families who need it really get it. And of course, data as well. Data needs to be built into from the beginning. It's you have to be able to know who's claiming the fund, the experience of it, the access of it, so that you can improve it and make sure it meets the needs of the people that it is meant to support. So, not to hijack your event, this is for this fantastic campaign, but I just thought I should put into context that Young Lives vs Cancer believes that no matter where you live, young patients, and in our case specifically young cancer patients, should have the right support with travel costs. We want similar funds and support to be in every nation of the UK, and we are campaigning on that. Any fund should be available as quickly as possible, as we've talked about. It should be paid up front, and it shouldn't be left to inconsistencies in local delivery. So to end, and all of that is why Young Lives vs Cancer has joined the coalition and is supporting this call here today, because we know that a fund like this will have a massive impact. We've heard about the emotional stress of these costs and what support a fund would give on that front. Obviously then the financial stability would greatly improve for families, and it also impacts medical outcomes and patient experience. Some of our own research has shown that a minority of patients sometimes don't go to their appointments or delay them because they're just worried about that cost. And that is obviously going to have terrible effects for people. And to come back to David made me think when Roblox, there was lots of recognition in the room at Roblox and Roblox, so I imagine there's lots of parents here, but if you don't know, it's an app and a game with lots of different games for children, and you have to purchase those Robux if you want to have certain upgrades. But it just made me think that children are children, and they just want to be children, whatever else is going on, and parents want to enable them to be children, and neither the children or the parents should be stressing about cost of living crisis or how they're going to afford to get somewhere. So I think between us all, there can't be any doubt that a fund like this is sorely needed. Thank you very much.
Thank you, Sonia and Ben. Your learnings have been really important to us as a coalition, so thanks for coming along this morning. Now, everything you've heard heard this morning from our researchers, families and charities should be inspiring you to want to help fix this problem. It should be willing you to want to understand more and help take action. The Coalition has a suggested solution, and here to tell you more is my co-chair, Alison McNulty, Chief Executive of Tiny Life.
Thank you, Joanne. I agree. It was very well said by our parents. No family should find themselves in debt because of the circumstances of having a sick or ill child that has to spend time in hospital. And the cost of that is an unnecessary burden on those families. Today we've heard robust local evidence that clearly indicates the need, both financially and practically. So today we want to call, our call to action is to launch the Young Patients Fund for Northern Ireland. But I'm going to digress slightly because in listening to some of our parents, I think even without this fund, there is an onus to support our families in the circumstances that they are in. And there are small things that can make a huge difference. Free car parking in the hospital, access to a kettle to make a hot drink, a fridge and a microwave to be able to feed themselves can go an awful long way and don't cost an awful lot. But for those families, we would like to say that they need financial support as well. We're calling on our government and others to have a dedicated fund of around 4 million a year to help families cover those hidden costs that you've heard today, and often those insurmountable costs of having a child in hospital. We feel that the system can be easily implemented and easily administered by us, the Northern Ireland Children's Health Coalition, because within our numbers we have the Family Fund, and they have extensive experience of providing support and handing out grants to many of our families. So we have also done some primary work around what that fund might look like. So we're calling on for families who had spent 3 consecutive days or nights in hospital as an inpatient, and having learned from Sonia and the young guys that they also would qualify as outpatients or having a particular diagnosis. So basically it covers anyone, any family, you have a child, you have to attend hospital for treatment as an inpatient or an outpatient. We also feel that while we may be challenged that there are currently packages of support in place for those families who have to travel out of Northern Ireland for treatment to GB or the Republic of Ireland, that those packages of support are inadequate and equally add a financial burden to our families. So we feel those families equally should be eligible for this fund. And can we simply verified that your child is in hospital by a GP, a consultant or social worker, or has to travel out of country for a treatment, or is attended as an inpatient? It needs to be non-means tested. We know from the work that we have done that even families who feel that they are adequately funded can go into debt very, very quickly when they have to make those insurmountable costs. And it should be minimum bureaucracy, very little paperwork to turn this around. It's not about keeping multiple receipts, about filling in multiple forms. We need to keep it as simple as possible. After all, we do not want to add additional stress to those families. So why should we do it? And actually, it's very clear that we should do it and it needs to be in place. And the onus isn't just on these charities to raise this. Under the UNCRC, emotional ties between a child and their parent or caregiver should be maintained when a child is undergoing treatment. So in Article 27, 1-3, if this is impeded by financial burden, children and families have the right to government assistance. It's a right, it's a child's right to be with their parents, to have that support, and those to have that financial support. So it's enshrined in UNCRC, which the UK government, including Northern Ireland, have signed up to. Here in Northern Ireland, we recently had the strategy for paediatric healthcare services provided in hospitals and in the community. And then again, in that strategy, it talks about accommodation for families, it talks about facilities for families, such as being able to wash clothes, to have shower, to be with your baby. And it very much gives our families the dignity and respect that they have in very challenging circumstances. That is, Hannah rightly said, that we can be the best parents that we can be in this situation. And this will lead to overall health improvements. We're kicking it down the line when we hear about the physical and emotional impact on our families. Having the right chair to sit in half the day when you have a bad back, access to psychological support. If that's done at the earliest point, then we will reduce those health inequalities and have better health improvements longer term. Let me also remind you that this research was carried out before the cost of living. So I think we could take a pen and multiply some of those costs and multiply some of the impacts. So this fund cannot come too soon. So therefore, we're calling on our MLAs, some who've been in the room today, of course some of them may watch this later on, to say, we need this yesterday. Not today, not tomorrow, yesterday. And even though there's no functioning executive, we call on our Department of Health to begin to look at this, because we need it yesterday, not today, not tomorrow. We've called on similar things before individually, but as a collective, this is one thing that cuts across all of our families, and we're calling for it immediately. It's not right that political and social inequalities are driving health inequalities, and it is the most vulnerable in the room today, our families who are paying the price. So whatever you can do to lobby, advocate and bring about change, we would love to work alongside you. This is just the first of a journey for us. We're also working with Nicola and her team on the mental and psychological impact, and I'm sure when we hear that, that will also add to the weight of having this fund. But today didn't just happen, so we're going to call for a call to action to have that Young Patients Fund. Today didn't just happen, so I just want to say a few thank yous on behalf of the Coalition. I think the most important people in this, not only in the room today, but those who are listening at home, who took time. You know, we've all busy lives, but do you add on that complexity of having a child in hospital or a very sick child? For those parents who took part in the research, who came today to tell their stories, which are very powerful. You know, and it isn't easy to sit there and tell and share your family life, your family story, or who took part in any of our press releases and our PR. A huge thank you to you, because without you, we've no mandate to do what we want to do, so thank you. Robust evidence and research is crucial to any argument, and the more local it is, the better it is, because we've had research from before, and people go, oh yeah, but what about Northern Ireland? It can be as bad here, it's worse, a million times worse. So thank you very much to Vic and her team, and to Nicola as well. To Ben, we had the pleasure of talking to you earlier, and Chantel too, because without them we wouldn't have this report. And yes, we did badge you, but it didn't take much honestly, I have to say. And like parents, we call on our family, friends and everybody we know who can help in any way. So the people who stepped into the space to help us with our calls today and to get the word out, thank you, because none of us in the coalition are real comms experts, so thank you to those who cajoled, got journalists here and are getting the message out. It's hugely important. And then lastly, for our sponsoring MLAs, many of whom have been with us on this journey over lots of times. Robin Swan, who shares his own personal story, a huge thank you. To Paul Bradshaw and to Colin Gildernew. And I'd like to say a personal thank you as well to my fellow members of the Coalition who have done tremendous work to get this out there in a very short period of time. So thank you to them. It's now time for a little bit of networking, a little bit of chilling out and chatting to some of our parents and some of those in the Coalition. So I'd invite you to join us for lunch, which is available at the back of the room. Thank you.